His chest and back, so I'm not going to take his shirt off, but I'm going to take a look at his back and look for any lesions, any irregular moles, or any skin tears or wounds on his back. And then I'm going to look for any thoracic configuration, and I'm going to palpate his spine to make sure he doesn't have any type of like scoliosis or irregularity in his spine. And then I would percuss his kidneys, so I would just tap and just look for any like pain or rebound from the kidneys. And for his lungs, I would, if his shirt was off, I would look at how his expansion is, is it symmetrical on both sides. If he's kind of one side of his chest is going out more than the other side. So you can take some deep breaths for me. Good. And then I'm just going to also take his lungs. Then we're going to have you take a couple deep breaths in for me. Good. I don't know any crackles or wheezing, and they're both clear bilaterally. And then I'm going to listen to his lungs on the anterior side. All the way. I'm going to listen to his heart. So I'm just going to count his respiration rate as he's sitting here for 30 seconds. So I would say his respiration rate is 14. I don't feel any, can you take some deep breaths? Any like crackles as he takes some deep breaths. So I'm just going to listen to his lungs and his heart sounds. Take some deep breaths. Just do more. Good. And then I'm just going to also do his heart sounds. You don't have to, you can just breathe normally now for me. Okay. And then I'm not going to take his shirt off, but I would look for the texture of his skin and look at his breathing again and make sure his chest raises and falls equally on both sides. So I would look at his breasts with his shirt off. I would look for the size and symmetry of them, the texture and color, making sure they're red in a natural color and not like blue or discolored. And look for any lesions or masses. So I would have my patient sit at like a 45-degree angle, like kind of like right here, to look at his jugular vein distension. So you can just set your face straight. He doesn't have any noticeable. That would be a significant sign of like heart failure or blood collecting in his carotid arteries. And then I'm going to take a look at his abdomen. So I'm going to have him lie down. So his lower extremities, I'm going to just take a look at his knees, make sure there's no swelling, bruising, ecchymosis. And then I would perform his reflex down here. So I would just hit his knee, and they would obviously signify any reflex if I hit it right. And then his feet, to perform his Achilles reflex down here, I would put my finger on the back of his Achilles and I would tap it, and his foot would go forward. So I would do that on both sides to perform that. And then, so his knees, range of motion, they're, go ahead and, yeah, and then the other knee. And his ankles, you can go ahead and rotate those. Range of motion is I'm gonna do the Romberg test. So he's gonna stand and then put his arms out, and he's gonna hold it with his eyes closed for 20 seconds. And I'm gonna look for any drift, any imbalances that he may have. Okay, good. And then you're gonna walk heel to toe, also looking for balances. Okay, good. Go ahead and sit back down. Your tiptoes towards me. Good, and then go back and walk on your heels towards me. Good, so he has no problem doing that. And then I'm gonna take a look at your spine. So you're just gonna bend over for me, and I'm just gonna feel for your spinal column. Go ahead and straight down. So it's even, all the way up and down. Go ahead. And then what I'm gonna have you do, you're gonna bend over and move side to side. So then this is taking a look at his spinal flexibility. Good. And I'm just gonna palpate your paravertebral muscles. Those muscles down in here. Any pain?
No.
They're even on both sides. So if his shirt was off, I was gonna look for symmetry in his stomach. I was gonna look for any skin texture, any abdominal distension. He doesn't have any abdominal distension, no bloating, anything like that. His skin is good, is clear, no rashes, no lesions. So I'm gonna listen to all 4 quadrants for vowel sounds. He has hypoactive vowel sounds, so I would say they're a little less than normal. I don't hear any brutes, any venous hums, or friction rubs in his quadrants. And then I would percuss his abdomen for any dullness. I would percuss his liver and his spleen. And then I would go ahead and palpate, not too far, but just for any rebound tenderness or pain. Are you having any pain when I palpate?
Nope.
Good. So he doesn't have any rebound tenderness either, which would be if I push down and then I release, you'd have any tenderness, nothing like that? Okay. And then I would palpate for Murphy's sign, which he doesn't have. Palpate for McBurney's sign. I would palpate the kidneys over here. So palpate up and underneath. Any tenderness?
A little bit.
A little bit? Palpate his spleen. Any tenderness up front?
No.
Okay. So after those, I would inspect the male genitalia, but I'm not doing that for this test. But I am going to palpate his hips, just to feel for any tenderness, where his hip bones lie. Oh, there it is. And then you can stand up for this. I'm gonna look at his the range of motion in his hips, so he's just gonna rotate it out. Good. And then rotate it out. Good. Okay, you can go sit back on.